Welcome to our fifth in a series of deep dives, and we got a great program ready for you today with some really great panelists. We were going to try to entertain you while you were waiting with the theme song for 2020, but it didn't quite work out. The theme song being Don't Stand Too Close to Me, if you remember the 1980 hit, that oldie but goodie from the new wave rock band, ironically called The Police. But you can hum that to yourself as we go along. At any rate, just a couple housekeeping measures before we get started. You'll notice that your video is not on and that you are muted. However, if you have questions throughout this program, please chat to the host, and all these relevant questions will be answered, hopefully, by one or both of our presenters at the appropriate time. So let's get started. We're really dealing with today with occupational safety and epidemiological health perspectives for reopening and reintegration during COVID-19. And so as the curve of infections begin to level off, or at least in Nebraska, and as state and local health directives or similar orders are relaxed, we have many businesses that were not deemed essential and had been trying to address this issue before, but they're beginning now to be confronted with some complexities, or what they might think of as complexities, in regard to employees returning to work or opening up the business to the public in a manner that's safe and ensures business continuity. So businesses are looking to implement a plan. They want one that's tailored to their mission, be responsive to the culture of that business and unique dynamics of that industry. So last week we had two sessions. We talked about legal liability and some of those inherent issues. This session is intended to deliver a number of the most salient issues that businesses are facing as the economy reopens and employees are returning to work, and discuss a number of best practices. And probably more important for the audience here today are some very practical approaches to manage workforce and business operations safely and in a manner to create a semblance of normalcy during the pandemic. So acknowledging, while it's not possible to create a one-size-fits-all approach to business reopenings and return to work challenges, most businesses will want, at a minimum, to implement a number of common measures. And that's what our panelists in today's session will discuss, which include topics such as recognizing appropriate occupational safety and health issues, creating a preparedness and response plan and policies, conducting an assessment for new protocols or equipment that should be put in place and consistent with OSHA rules, including proper PPE and hygiene issues. Also an adoption of business operations in consideration of all stakeholders, be they patrons, customers, employees, third-party servicers, and so forth. And talk a little bit about phases of reintegration from a health perspective, and finally discussing some case management strategies and related practical issues. So let's move on to the program itself. I'd like to introduce to you Lisa Henning. You might give a wave, Lisa. And she is the Executive Director of the Nebraska Safety Council and WorkWell. They're based in Lincoln. Lisa has over 27 years of experience in business wellness and prevention in that arena, and including 22 years of experience with WorkWell before assuming her current position. She previously led the implementation of a 2-year CDC National Healthy Worksite program. And she's been the recipient of a number of awards, including the Governor's Excellence in Leadership by then Governor Dave Heinemann, Healthy Innovation Award program by the CDC, Live Healthy Nebraska Award by the Nebraska Sports Council, and the Well City Lincoln Award. A little bit about the Safety Council itself, in case you're not familiar. They do provide support and services for organizations of all sizes and across a wide range of industries throughout Nebraska, as well as surrounding states. The Nebraska Safety Council's programs, their training courses, events and services are designed to improve employee care at the desk, on the production floor, even behind the wheel, but certainly on the job as well as off the job. The council has a worker 360-degree approach, and it provides that in that regard an integrated risk management system to reduce health and injury related costs, boost worker engagement, improve overall worker quality of life, and all the while looking to improve the organization's bottom line. And it's the only certified CDC National Institute for Occupational Safety and Health affiliate in Nebraska. And then our second panelist is Shelley Schwendhelm. And Shelley is the Executive Director of Emergency Management and Biopreparedness at Nebraska Medicine. She served in leadership roles within Nebraska Medicine for 35 years. And she has an extensive knowledge in clinical skills, human resources, risk management, as well as regulatory and legal, financial, and contracting backgrounds. And her experience includes emergency and trauma services, infection prevention, emergency preparedness, clinical operations, as well as a number of assigned projects. And she had overall accountability for the biocontainment unit operations and logistics during the Ebola virus disease outbreak. And she traveled on readiness site visits with the CDC, developing an education training program held on the UNMC campus. She oversees a number of grants associated with infectious disease and is a program director and subject matter expert with the National Ebola Training and Education Center. Needless to say, she's authored a number of publications or contributed to a number of subject matter publications. She has degrees from Methodist School of Nursing, her Bachelor of Science in Nursing from the University of Nebraska, and her Master's in Nursing Administration from Nebraska Wesleyan. And she's also certified as an advanced nurse executive. So we're going to turn the program over to Lisa Henning from the Safety Council, and we're anxious to hear your advice.
Okay, well, thank you, Ron. I want to make sure, can you hear me okay? We're good?
Yeah.
Okay. I want to make sure that today's discussion doesn't minimize the seriousness of this pandemic, but provides us a practical approach to addressing this pandemic at the workplace. So let's see if we can get our screen share going here. Can you see that, Ron?
Yes.
Okay. So again, one thing that's really, well, for some reason my screen doesn't want to keep moving here, so let me try to go to the next. A little bit about us. Ron had introduced us, but we're just a small organization. We have 12 full-time employees, 24 part-time employees across the state. And so a lot of what I'm going to talk about today is very realistic in terms of what a small organization can do, but also what any large organization can also implement. Again, not to minimize the responsibility to keep our people, meaning our own people, our employees, and the public safe and well. This is a very serious time, but we don't want to escalate the situation either. So we want to demonstrate a good faith effort towards following public health guidelines and OSHA regulations and guidelines to keep people and the public safe. So one of the things that's really clear, obviously we have our phase plans within the state. You should have a phase plan as well within your organization. You should have a very clear policy for your people. Obviously, we've been speaking a lot about sanitizing daily. Determine which screening protocols you want to hold employees accountable to. As you know, it is legal to be able to take people's temperatures at the workplace, but you have to determine whether you're going to do that or ask them to screen themselves. Utilize sign-in and sign-out procedures, and we'll talk and show you our procedure. Determine PPE requirements that are necessary for your jobs. Keep communications open about personal and business travel, quarantine expectations. So, for example, this is a high travel time for our people personally, and each one of our employees speaks with me before they go out on their leave so that we can discuss what's going to be expected of them coming back. And it varies by what they are doing, how they're traveling, and then, of course, being flexible whenever possible for special circumstances. So in your policy, some kind of key elements that you should always consider. Obviously, you want to talk about the importance of screening, and following the CDC guidelines are what you should be screening for. Talk about the quarantine requirements, and remember family members. If you have a family member that is presenting signs and symptoms of COVID or is recovering from COVID, what are your quarantine requirements for your employees? We have a board member that her husband contracted COVID, then she contracted COVID. She tested negative 3 weeks before he did. She was not allowed back in the office until he tested negative again. So keep that in mind when you're determining your policy. Of course, you know, social distancing, very important, and having social distancing within your workplace, but in your common areas, the use of PPE, masks are critically important. If at all possible, please try to institute that. Sanitizing. What happens if somebody becomes ill while they're working? What's your practice? What's the policy going to state? Ours, for example, says the employee is to immediately leave the office and call their supervisor when they're out of the office, and then we will deal with it. We'll be clearing the office at that point and sanitizing before people are allowed back in. We'll also share our tracing, our sign-in and sign-out forms and stuff with our local public health department. Do employees have to test negative before returning to work? Listen to employees' concerns and adjust when necessary. What we're learning is you may be making every effort to make things safe and clear for your employees, but their perception is kind of the guiding star here, and so we need to make sure that we're minimizing those fears. And then what happens if the policy is violated? How are you going to handle it? Are you handling it just like any other policy within your workplace? This screening form I've been given permission to show you. It's from Molex, a manufacturing organization here in Lincoln. And it's pretty basic. It covers the CDC symptoms. If somebody says yes, they do not enter the workplace. If they say no, then the next question is if they had any close contact with somebody who has or suspected of having COVID in the last 14 days. If it's yes, they do not enter the workplace. If they do say no to both of those, then they are allowed to go forward and go inside the workplace. So this is something we've asked to borrow this and use it with our own people. And it's a very simple flow chart for people to follow. So keep it simple. Obviously, you know, the use of sanitation, hand sanitizers, and anything that you can do to clean your place. In our company, when we return back to work, we're still remoting, but we will be returning back in a partial capacity in July. And the workplace will actually stop what it's doing at 4 o'clock every day, and we will be sanitizing. Right now, the way it works in our company is if you are in the office, you sign in. This is our sheet. You can see I signed in that day, and you have to verify that you are symptom-free. So we're asking everybody to take their temperature and to go through the symptom checklist, and if they are symptom-free, they check there. We're not taking their temperature. And then they check off that they've also conducted their outbound cleaning. So as we leave the office, now if we're in the office, we are responsible for sanitizing common surfaces that we touch, the copier machine, the light switch, the door handles, those kind of things before we go out the door. So some companies have expressed that they want employees to see the visible cleaning, the cleaning crew to come in while they're in office hours and operations so that they can see that it's being done. That might be a consideration that you want to think about. Our employees will be required to wear masks, and they are currently already in our common areas. Also, if you are in a semi-private office, our folks are going to rotate days in the office, so it's only one of them in a semi-private office right now. They're allowed to take their mask off when the door is shut to their office, but the moment somebody enters their office, they need to wear it, and the person walking into their office needs to wear it, and if you're in a common area, you need to wear your mask. So we really endorse the use of proper PPE. It's critically important. One of the things that our company does is we are doing respiratory fit training for healthcare systems and public safety officials, and we've done the entire city of Grand Island. So we're right in the thick of, keeping that on the front line. So we know the importance of this. We want to also share with you that I know a lot of places have invested in some very nice looking acrylic barriers or plexiglass barriers, but you do not have to invest in expensive barriers. This is our office. This is one of our reception desks. And we've created a plastic barrier with a shower curtain and a PVC rod. Thank goodness for my husband, who's pretty handy and can do these kind of things. So, it doesn't have to be an expensive thing to create that water permeable barrier so that we can make sure that people are safe, both our customer and our people. This is an example of a business that chose to use, an old 12-panel window and hung it with some serious chains between the cashier and the customer, with obviously hand sanitizer as well for the customer. So just some simple things that you really don't have to invest in expensive stuff to try to keep that barrier and keep people safe. You do have to be flexible with your people. As you saw, if you are in Lincoln, LPS is opening up this school year at full force with masks. And until then, if you're heading back into the office, like our team is partially in July, we still have school-age kids that are at home, and their summer camps are not open for them. So you may still have to work with your families and allow them to partially work from home. This is our CFO's wife and stepson, and he was in the middle of doing his school lessons while his wife was working. She works for the university in the international students department. And so, we still have some of those things that we have to try and be flexible for. If you can, try to do that for your people. Another thing that we're being flexible with, this little guy is only 3 pounds, 10 ounces in this picture. He was born 6 weeks early. This is our receptionist, Sage, and gave me permission to show him. He's obviously still in the NICU because he has all of his wires still. Thankfully, he did not have to be on oxygen at all in the NICU. But she's pretty nervous about sending him to daycare when she heads back to the office because of his compromised health status. And so what we are agreeing to with her for the first time, we will have a newborn in the office with a pack and play behind her desk. And we're going to let her try this for the first 6 months of life. He's actually a pretty chill baby, as she's been on several calls and Zoom meetings with us, and he doesn't seem to know how to let out a full-out cry, which is okay. The other thing I wanted to share with you is something that was released on April 29th in conjunction with several partners. This is the NIOSH Employer COVID Guide that we helped develop. And so I'm going to try and show you this if I can, if it'll allow me. It may not allow me. This guide was, is this showing on as I'm transitioning to our guide online? Or whoever is listening?
No, I don't see it transition, Lisa.
Okay. Well, what I'm going to say to you is, if you go to our website at nesafetycouncil.org, this guide is on our banner, and it will take you to the link. It has various case study examples in there, including several of our Nebraska businesses, such as Hexagon, Garner, GreenQuest, several companies, and all different types of industries from within the Midwest region, and including schools, manufacturing, office, healthcare, the University of Kansas Medical Center, Wichita is in this. So various case studies on what businesses are doing, and there's differences in every single one. One of the things that I will share with you, and I'm certain that UNMC has probably done this as well, is, you know, like our organization, we have set up, we were concerned about our young people that live in, you know, a one-bedroom apartment with, you know, a partner or spouse or something, and if somebody becomes ill, where does the other one go when there's really not the ability to separate? So we made a deal with one of our hotels in the region, and they're giving our people half-price discount if they would need to go there. So that's another thing that we have tried to arrange. So consider some of those kind of things. But this guide is really a nice, simple resource for you with lots of case studies. So I just wanted to share that with you. Those are some of the things I wanted to share. It's really important, just again, to be practical. Do your best part, do your due diligence to try and keep people safe, and avoid gross negligence, obviously, but give the good faith effort, and I think everybody can go back in a safe manner. So that's all I have. Is there anything else from a question standpoint?
All right, please direct your questions to the host in the chat box, and I'll turn it to Kristen. Do you have any questions?
Just two. Do you have any recommendations on sort of standards for the masks?
For the masks, well, if you follow the CDC guidelines, they're saying that depending on your industry, obviously, right? So some industries do need to have the N95 mask, and you'll need to work with your local public health officials if you're having a hard time getting that. But the CDC guidelines are saying that cloth masks are okay. They primarily are there to prevent us from infecting others. If I wear it, it will contain my germs more. It's really not going to help me if somebody coughs directly on me, but it's doing my part to protect others. So the cloth masks are acceptable in most situations.
And I think this might be for both of the speakers, just some additional guidance or thoughts about workplaces where there is greater proximity, lunchrooms, break rooms, locker rooms.
Right, and I think I'll let Shelley handle that because I think she's been working with a lot of businesses on that, so I'll defer to her on that.
Yeah, definitely the masking requirement, and then really figuring out, are there some unique alternative locations where you could expand the opportunity for breaks and lunches, whether that be a tent outside or additional rooms that may not be being used, you know, and stagger your breaks and lunches to just make those more of a purposeful schedule to make sure you can continue to physically distance people.
And I have one more, and then I'll turn it back over to Ron. So oftentimes someone might want to or prefer not to follow PPE requirements. Do you have any recommendations for individuals who refuse to refuse those PPE requirements?
Our position has always been if you have a policy and you have standards in place to set up for PPE, that it's just like you would handle any other HR issue, which is a violation of policy, and how do you handle that within your workplace for disciplinary action. So it would follow any violation of policy. That's what we're saying. Shelley, you have the HR background too.
Yeah, I just think it's important like when you start to bring people back, that you just clarify those expectations, and whether it's guidelines or it's a hard and fast policy, it's about safety of your workforce. And so therefore we all should be able to commit to that sort of kind of construct in the work environment.
All right, with those two questions answered, I'm going to turn it back to you, over to you, Shelley, and look forward to your presentation as well.
Great. Thank you, everybody, for joining today. And I just have a few things to cover, and then we'll open it up for questions. So today on the call, I have Dr. Chris Cradaville and Dr. Jana Broadhurst joining me. Dr. Cradaville is one of our executive leaders here at the Global Center for Health Security, and Dr. Broadhurst is medical director of our biocontainment unit lab and also a pathologist by training. So if there are questions about laboratory testing from anybody, we can do that as we move through the presentation. So let's see, yeah, I'm struggling too to get it to go. So we'll go this way. All right, so this slide is just to let you know that there's a lot of resources and dashboards out there, so find reputable ones. Johns Hopkins has one on their website, and this is a GE dashboard, and this is from yesterday. So I'm happy to report that Nebraska is no longer in the top 10. So what this tells you when you look at it is that over the last 14 days, our average number of confirmed cases per 1 million population is 93. So you can see there the top 10 ended at 95 cases per 1 million. And then in parentheses is the average new deaths per 1 million. And this looks at, like I said, a 14-day period. So we're at the 2 mark, so we've moved below the top 10 in that regard as well. So that's definitely great news. Then I also want to call your attention, and you're all probably very familiar with this website, which is the Nebraska Department of Health and Human Services website. So they just continue to enhance this. This view here shows you sort of a heat map of the state and where cases have been over the last 14 days. You can see the numbers. In the right-hand column, total testing done. There's also a hospital capacity tab that we review often in our daily touch points to see like percentage of ventilators available, percentage of hospital beds available, etc. So I just want to call your attention to those resources. So I'm just going to briefly spend a few minutes talking with you about some of our work on behalf of the Global Center for Health Security here at UNMC Nebraska Medicine. And we saw really an opportunity to provide some technical assistance support, but also some on-site visit support, and I'll walk through those briefly. So we've been to 14 meat packing plants, 44 long-term care facilities and assisted living facilities, about 5 shelters and 2 correctional facilities. And we've done that by really focusing on using the framework. It's a risk mitigation framework from NIOSH, the National Institute of Occupational Safety and Health, walking through what are the most effective controls to the least effective. So Lisa did a nice job of really outlining a couple of engineering controls, predominantly administrative controls. So I just want to elaborate just a little bit on this, that in elimination and substitution, we don't have the ability to physically remove the hazard or replace the hazard right now. So until we have a vaccine, some of that won't be possible. So really we rely on the engineering controls, which is putting those physical barriers in place between the hazard and the people. So Lisa demonstrated a few of those by putting those barriers, those physical, plexiglass, plastic, things like that in places that make sense to reduce the potential for spread. The other thing in engineering controls that we think about, but many times is really hard to achieve, is looking at your air handling system, and given the age of some buildings, that's more or less possible to increase fresh air intake and reduce the amount of air that's recirculated. So those are just examples of engineering controls. And then Lisa, really where the predominant number of things that we can actually do is in the administrative controls section. So she talked a little bit about screening, you know, the temperature, the system checks, the environmental cleaning, changing the way that people do work. So we think about what are the workforce policies right now. You heard her talk a lot about some flexibility in that regard. What education materials, communication strategies, visuals, checklists, those sorts of things fall into that administrative controls category. And then personal protective equipment, you know, we often place a lot of our emphasis on personal protective equipment. And don't get me wrong, it's really critically important, and it protects the worker when they're wearing the personal protective equipment. But the interesting thing about PPE is we just need to remind ourselves that people are human and it may not be worn correctly. So I can't tell you how many times we see people with it under their nose and things like that. So wearing it correctly makes a huge difference as well. So it's not any one of these things that makes the huge difference. It's a lot of little things. So in meatpacking plants, we've been able to really go in and offer advice and thoughts on these sorts of controls. And what would make sense to them. We, in long-term care and assisted living, just informational right now, there's 496 of these long-term care and assisted living facilities. There's roughly 137 facilities that are impacted right now, or about 28% of our facilities across Nebraska are impacted with COVID cases. 570 individuals of residents in these facilities with COVID or recovering from COVID, and about 102 of our deaths in the state of Nebraska. And I think you saw the slide that I think showed 200 and some odd deaths. So it's been a pretty significant issue for us here in Nebraska. So we've had a couple of our teams, our grant teams out there and doing technical assistance whenever a case occurs, and proactively training weekly on webinars. And then we've got an on-site team that's gone in and helped. And then shelters, you know, a lot of those are fairly complex too, and a lot of people. And, you know, coupled with mental illness and lots of other things that go on, it's really hard to hardwire the masking protocol, trying to think about ways to develop quarantine locations and isolation locations within large facilities with big amounts of bunk beds. So it's been rather complex to go in there and try to apply these controls. And then correctional facilities as well. So the ones that we've seen who have been really successful are the ones that have developed a process and a space within the jail system to be able to have inmates, as they're brought in, be kind of cohorted for that 14-day period, and then moved into the inner workings of the rest of the jail system. So there's just tons of different strategies for different groups of people. We worked with the county extension agents. I'm going to go to the next page here and kind of talk a little bit about a few of our projects. So we've been working with the county extension agents across the state to really talk about how to bring them back into their work environments, but you know, everybody wants to have the county fair. So how are we going to handle the exhibits? How are we going to make sure that physical distancing happens? We've been able to create playbooks for many of these industries. So on our Global Center for Health Security website, if you're interested in really fully understanding more about what the engineering controls are, what the administrative controls are, the PPE, and other things for all these individual end user groups, you're more than welcome to go out there, download it, use it as you wish. Dr. Cradaville's led a team to look at the Big Ten. You know, how do we bring these athletes back to campus? How do we begin to think about practice? How do you think about getting back to competition? And then the court system, how do you begin having hearings and trials, and what does it look like in a court system to apply some of these principles? So finally, I'm going to finish and then give our couple of other folks here an opportunity to add. I just wanted to let any of you know out there from the Global Center for Health Security, a good amount of our work so far we have done based upon the needs from the State Health Department. We have then put together some opportunity to be able to do this with individual businesses if there's interest. And then I know some of the big things on people's mind is the whole testing strategy and what about antibody testing and all that important things too as your businesses ramp back up. Dr. Cradaville, Dr. Broadhurst, anything you would like to add?
Yeah, this is Chris. I'll just add just a couple comments. Great overview, Shelley. And I think what I'll say is the fact that, you know, over the last several years, we've really advocated for how much we've been able to have synergy by the University of Nebraska Medical Center partnering with Nebraska Medicine. And I think doing that, we've been able to really advance the entire academic health center into things like biocontainment, organ transplant, to the Eye Institute. And one of the things that we're really trying to do at this point is really promote some of that public-private partnership with business as well. So I think what Shelley's highlighting by the work with the packing plants, the athletics, the court systems, things like that, that there are hopefully some resources that we can extend to help support the businesses in the community as well. Thanks, Shelley.
So Ron, maybe we'll go back to questions when you're ready.
We're all set. That sounds great. Kristen, do we have questions?
Yes. So do you guys have any thoughts about pop-up testing sites for businesses or events? You know, a few folks are being approached with that as an opportunity. Do you guys have thoughts or best practices, or should they be avoided or brought in? You know, what's your thoughts there?
I don't know, Dr. Cradaville or Dr. Broadhurst, one of you want to take that?
Jana, go right ahead.
All right, thank you. Hi, everyone. Yeah, that's an interesting question, and I think that we've actually come quite a long way since those types of operations were initially proposed. So I really think the most important question to ask when evaluating options like those are really just how you intend to use the test result. So there are now really a wide variety of reliable testing options available for both detection of the virus and detection of antibodies. But I think any time you approach an operation, you have to ask, what are you going to do with the test result? And that can help inform which type of test you use and which characteristics of that test are important for your use case. So happy to dive into a particular use case of a test, but I think as a general framework, that's where it begins.
And I will throw in there just to highlight one word that Dr. Broadhurst used, that was valid. And I think the key thing is if it's a reliable test, you know, if it's affiliated with one of the hospitals here, something like that, that's very different than, you know, I think if you have an external entity that comes in town and sets up a tent, I think that's different. So I think, you know, clearly making sure that it's going to be reliable, because if you're going to be using that testing to make decisions, you want to make sure you're making the right decisions.
And I'll just add to that comment. I love that comment. Thank you. The FDA really over the past several weeks has made great strides in collating information about test performance and really making that information very accessible and user-friendly, even if evaluating diagnostic tests is not what you do day in and day out. They've really partnered with the CDC, with the NIOSH and other you know, large operations to systematically evaluate the performance of a variety of tests and make those results really easy to understand and easy to find on the FDA website. So, you know, if a use of a particular test is proposed, it's a pretty straightforward search now to find whether or not that test has been evaluated by the FDA, and if so, what its comparative performance is to other tests that are available. So that's, I think, some great strides that have been made over the past few weeks.
In dealing with like coworkers getting sick, do you have any recommendations for how to alert other employees or how to handle that in the workplace?
Yeah, that's an interesting question, and one that different industries are handling differently. So, you know, it's a balance, right, of privacy and need to know. So if people were in, you know, close contact with the individuals, then they're going to be alerted of the need to quarantine for 14 days. So every industry is just a little bit different with that. So, but for the most part, I think, you know, if you're one of the close contacts that's identified, they'll let you know. But for me to let Sally know, who wasn't even working in the same, you know, building, but works for the same company, that Misty over in the other building has COVID, that's really where I think that ends. You know, it's the close contacts, and then they're notified only because then they need to quarantine for that 14 days. Or maybe get tested at some point and things like that.
In terms of asking about family members who have been ill, is there a best practice or a way to sort of those sorts of health questions for employees?
Yeah, we've seen different perspectives, you know, in different venues and companies. CDC basically has some great guidance. They've got a list of 7 symptoms, and have you or any family, have you been in close contact with anyone with COVID is typically a question, and then do you have any of these symptoms today? So that's typically what we're seeing in long-term care and in meat packing plants and others when people arrive to work. Those are the questions being asked.
Do you have any thoughts on long-term care facilities opening back up for family member visits?
Yeah, actually, just in the last few days, there's been some guidance put out. So it's out on the Nebraska State Health Department's website. So there are different phases, and it's going to directly tie back to your individual county and sort of where they're at in the phased approach of reopening. And then each facility, there's quite a bit of accountability for each facility to do some testing of both residents and staff. And there's some paperwork to do with the state and other things. So that's just high level. So I would just encourage you all to go and look at the document that's just been posted on that topic.
Any other, Kristen?
That's all that I have right now, Ron.
All right, keep your screens on, please. And I've got a question that we've been asked by some employers, and like to have both Lisa and Shelley and group perhaps address them individually. But we have a situation where a number of companies can't afford to recall fewer than all employees back to work. And when they can do that, they're saying, you know, we've got a lot of employee fear out there. Or we have fearless employees. One of the two, it seems like the extremes these days. And some of the ones that probably are fearless are more high at risk sometimes and aren't requesting accommodations. So it's a matter of perception as well. So you have to be careful, I understand, in that regard. But what would you recommend as a best practice as far as a business can afford to return employees to work? Is it best to test the waters and do it gradually and integrate over time, or do a full recall? Secondly, what about high-risk employees what kind of practical advice or case studies has there been in regard to that, and how to accommodate such employees? Let's start with Lisa. We haven't heard from you for a while. And then we'll go to Shelley and group.
Well, I would say this. I think it really depends on the culture in every company. I know that's kind of an easy way out to address that, but the reality of it is you really have to take the time to get to know what your employees' fears are, try to address those as much as possible, and make sure that people are comfortable. I have my own people. I've got various levels of fear and not fear in my group. I have one employee who will not do some of the job functions that are asked of her because of her fear of COVID. And so we've had the extreme opposites in some of our people. I will tell you for people that have underlying health risks, we are following physician recommendations. And so if they have that, they present it to us, we discuss it and see what their options are. We've also had to address underlying health risks for family members as well, especially children that are too young to be by themselves in the home. I have an employee whose son has asthma. Even though people with asthma seem to be doing pretty well if they're on ACE inhibitors, I can tell you that that's a real fear for her to send that child to daycare. So we are working through her work schedule to see when we return, can she take the child to the mother twice a week and then be in the office twice a week. And that's probably the most we'll be asking of her to come into the office. She's proven herself to be able to work well remotely, and we're making those accommodations for her. So it takes a little bit extra time from an HR perspective to learn what the people's fears are and try to suppress some of that and try to address some of that. And then but you really have to, just like you would with any other ADA requirements, you need to listen to what the physician recommendations are for these employees and whether they should be returning to work and in what capacity.
Yeah, I would agree with everything Lisa's just said. I think information and education builds confidence. So really understanding their fears and then working to find them evidence. And, maybe sometimes it isn't just us giving the evidence, or us giving the commentary, it's actually giving them the evidence in the literature to help support them. It's also important to do it in a way that's understandable. So meatpacking plants is a great example. So CDC now has about 10 or 12 different languages with the posters on the COVID symptoms, hand washing, how to wear a mask properly, lots of those sorts of things. And then I think, we're in a period of time now where we're not out of the woods, so if there's an opportunity and your company can benefit and you've got people that are productive in a tele capacity, let them stay in that capacity. I think there's a lot of things that we've learned in COVID that I don't want to give up on. And one of those is our telemedicine strategies in some regards. But I also think that, there are going to be times where we also need to make sure that we can give them, allay their anxiety about the work environment. So it's up to us as leaders to make sure that there aren't 25 people in a small break room, that those things are very well orchestrated and we've got opportunities for them to be physically distanced, to be compliant with the things we're expecting of them. Chris and Jana, anything else you would add?
Shelley, I think just to build on what you're saying, basically what I'm hearing and kind of my way of thinking through it is whether they're anxious or they're fearless, the two core approaches are one, education, to make sure those that are anxious understand what the realistic threat is, and those that are fearless understand what the threat is, but also setting the expectations. And I think if you're anxious, you're going to feel better if everyone together is doing the hand washing, the distancing, the masking, and doing those kind of things to protect the entire work team. And I think for everyone, they just need to understand that as a team member, these are the expectations. So hopefully that education and expectations will help to level set everyone.
Okay. You had mentioned long-term care And I was wondering if there's any studies being done in regard to the mental health issues regarding the impact of isolation in that regard.
Yeah, I don't know of any current studies, but there absolutely needs to be. I think, you know, one of the things that has been visualized in these folks is the unintended consequences of isolation and quarantine. So one of those is mental illness, depression, when they can't see their loved ones, they don't have their usual common things and routines that they've had for forever because now COVID's in their building. Even urinary tract infections, which we know is pretty prevalent in older people. You know, if they're out in now environments and we're expecting them to wear a mask, are they really drinking fluids like they need to be? So I think there's a tremendous number of unintended consequences of all of this. So I think it's going to be really important to provide those wraparound services and to do our very best to mitigate infection from the get-go, but then to quickly move them back towards some sort of normal strategy as quickly as possible.
Ron, it's interesting that you brought that up because mental health is the leading lost cause of productivity in the United States. And in Nebraska, the Department of Health and Human Services does a study of businesses every 2 years. In the last study, mental health was the leading cause by a 40% margin over obesity-related illnesses. So one of the things that is in consideration, we know that there's a strain on mental health right now in America for the people who are isolated and working from home. Now, I agree with Shelley. If you can try to have as much telecommuting available to your people, please do. But I can tell you in our company, we've been successfully telecommuting from home, but I can absolutely tell you the employees within our organization, I notice the ones that struggle with anxiety and mental health, and it's exacerbated in this time. And so part of the reason that we're going to come back in a partial capacity is some of that, you know, to give the people some of that ability to be around others that they so desperately right now need. We're really trying to leverage some of the EAP resources with our people and remind people to use their employee assistance programs. But it's a balance here of, you know, we know that it's safer to work at home, but we also know there's other pressing health needs that are at stake here with our people, and that's one of them. So,
do you see then the rise a bit of more substance abuse or alcohol use or that kind of thing?
I haven't seen the studies on it unless you have at UNMC, but that's my understanding. The interesting thing is, unlike other public health indices, so in other indicators, for example, we know that there's a socioeconomic relationship, right? So if you the more you make, the better quality food you eat. The more educated you are, etc. Alcohol is the exact opposite. It's the only thing that's the exact opposite of that. So the more you make, the more educated you are, the more you abuse alcohol. And so it's a very interesting, it's the only indicator that is exactly opposite. And that goes to it stands to reason, because people that are more educated tend to do things and have more money. They tend to go into wine and cheese functions and things like that. And it's so easy to say, oh, that's not our issue. I've worked with large medical clinics who think that the issue is their janitorial staff. But the janitorial staff are not going to wine and cheese functions in general, okay? So it does stand to reason that there's probably an increase in substance abuse. We've seen it historically over time when there have been, you know, times of recession and depression and all those kind of things. It makes sense. So it is something to address. Yeah.
Yeah, and the one thing that I'll add is that, you know, we certainly know that the lack of psychosocial support and things can cause problems, and that's being exacerbated. Right. But also in parallel, we're seeing that the individuals who typically are engaged with their mental health professionals or their substance abuse counselors have had limited access to them. So even the supports that they had in those professional arenas are often limited, or at least limited to telehealth.
Any other questions, Kristen?
Nope, none over here.
Okay, well, we're just about at the hour mark. I'd like to thank all of our panelists for, I thought it was an excellent program. I thought you gave a lot of great advice and assurance to the community that you're addressing here today. I think it's most important, you know, that you addressed, you know, the health and employee concerns, and that all wraps around with the liability risks all at once. So essentially, you're talking about policies and protocols and enforcement of that, and that there are solutions that are, you know, can be low cost. Just need a little imagination here as well, and just better communication, not only among the employer and employees, but also with your patrons and your customers as to what expectations are. And there aren't surprises, and that should give a little bit more assurance for everyone. So thank you so much. We appreciate your time and your willingness to share your expertise with us, and that'll close our session for today. Thanks again, everyone.
Thank you.
Thank you.